talk about air travel and pregnancy. Very important Rcog guideline. So everybody has a doubt of whether we should go in early trimester or not in flight. So today we will discuss all these things. Everybody has to listen properly, and please like and subscribe so that I can upload. I get some motivations to upload any new guidelines or new classes. Okay. So air travel and pregnancy. The obstetrician are commonly asked to give advice whether it is suitable for women who are pregnant to fly during the pregnancy or not. Such advice is because the physiological and environmental changes that will cause possibility of preterm labor and obstetric emergency while traveling during flight, particularly those women approaching 37 weeks gestation who have a risk of preterm labor. So remember, first thing, if it is a singleton pregnancy, she can't travel after 37 weeks, no. If it is a twin gestational is after 32 weeks, no to travel. Okay, remember this is very important point. If it is a singleton pregnancy, you have to avoid 37 weeks. If it is multiple pregnancy, you have to avoid after 32 weeks. Okay, because all the risk of preterm labor, premature rupture of membrane, abruptions, everything is happening in this period. Okay. Cabin attitudes. With regard to any adverse effect of air travel on pregnancy, there is no good data to suggest that commercial airline travel is associated with increased risk of adverse pregnancy outcome in terms of preterm labor, preterm rupture of membrane, and abruption. Very less studies have been done, but there is no such complete risk. Only if there is nasal congestion, which is more common because of the versatile pregnancy. For some women, those have already motion sickness will be a problem. This may accentuate the morning sickness. The duration of the flight will majorly the duration will matter. The duration of flight will lead to significant immobility and increased risk of leg edema and deep vein thrombosis. In addition, when coupled with physiological changes in the coagulation system in pregnancy, this may accentuate the risk of thrombosis, particularly if the further increased risk factor will be present. If she had a previous history of DVT, remember these are the risk factors. Previous history of DVT plus morbid obesity, these are very important risk factor, then you should avoid. In these patients, you should avoid air traveling because already they have a risk factor, they have a previous history of deep vein thrombosis, they have a morbid obesity that will cause more chances to again chances of deep vein thrombosis. Okay. Then body scanner, usually an issue that women increasingly ask about the use of body scanner while backscatter machines utilizing ionized radiation for security during the prior to flying. They have a security check, they use a body scanner. So that body scanner has very negligible radiation dose. Remember, very negligible radiation dose are observed into the body, therefore the fetal dose is much lower than the dose to be a pregnant woman. So it is very negligible, so that will not cause that much hamper. So every woman there this dose level is not considered a significant risk, therefore there is no information to suggest that a pregnant woman should avoid security. So everybody can go for a security scan, there is no issue, they can go. Okay. The airline concern, as the majority of pregnancy completed weeks of gestation extend to at least 37 weeks gestation less, many airlines don't allow women fly after 36 weeks because of the risk. If there is significant risk factor, like if they have already risk factor of preterm labor, such as in multiple pregnancy, women should not fly after 32 weeks. In such women considered at risk of preterm labor birth may be useful to specific expert advice. Okay. Then conditions that obstetricians should majorly we have aware about those patients who, if they have no specific risk factors, they can go. If they have some specific risk factor, they should avoid. Like example of relevant medical complications which may occur during the pregnancy and which would contraindicate commercial air travel. These are the contraindication. Remember, very important. Everybody whoever if you are practicing in a metro city, they will ask all these things. Patients will ask if there will be severe anemia with hemoglobin less than 7.5 gram per deciliter, that is the contraindications. Recent history of hemorrhage, otitis media or sinusitis, that is a contraindication. Serious cardiac and respiratory disease, recent cyclic crisis. Okay. Recent GI surgery including laparoscopic surgery where there have been gastrointestinal procedure carried out where suture line on the intestine and could come under stress, that could undercome stress to the reduction during the reduction on the pressure and gases expansion. A fractures where significant leg swelling, can occur in the flight, particularly the hazardous in the first few days of cast being placed. Okay, remember, very very important. First was a severe anemia, that is anemia if it is hemoglobin is less than 7.5 gram, recent hemorrhage, arteritis medius, sinusitis, serious cardiac and respiratory disease. Okay, serious cardiac and respiratory disease, and recent sickling crisis, recent GI surgery where the suture line on the intestine that could cause during the reduction in the sudden pressure and gases expansion that cause stage on the suture line, any fractures that cause significant swelling during the flight, that these are the contraindications. Particularly concern, our main concern is the deep vein thrombosis. Although the absolute risk is very very small, the risk likely to be increased air traveling due to immobility. Those are the risk factor. These are the conditions that will aggravate if you continuously immobility. Sometimes cramped condition for taller women. The true frequency debate, mainly the true frequency of debate during long haul flight is unknown, difficult to determine. It except that prolonged air travel resulted in small increase in the absolute incidence of venous thromboembolism, around threefold, and 18% of high risk of venous thromboembolism for if you every each 2 hour the risk will increase, every each 2 hour delay in the flight. Okay, the risk will be increased 18%, high risk of venous flight durations. However, overall absolute incidence is very very low, so you can usually if the flight is prolonged duration, they are telling if it is more than 4 hours, so there is an increased incidence those with thrombophilia and combined oral contraceptive use. To combat this risk, we have an evidence that you can use a graduated elastic compressions stocking, elastic compression stocking during flight to reduce the risk of asymptomatic DVT with a relative risk of 0.10. Then practical consideration, what all advice you should give for the pregnant women. For women with uncomplicated, suppose they have uncomplicated pregnancy, no medical and obstetric risk factors for complication that would contraindicate air travel. There is no indication to advise against the commercial air travel. So if there is no complication, totally uncomplicated pregnancy, remember, if it is totally uncomplicated pregnancy, no medical, no obstetric risk factors or complications that will contraindicate the air travel, there is no indication to you should not advise, don't go. You have they can easily go if there has no risk factor, no medical, no obstetric risk factors. Remember, very very important, they can give. Specifically, there is no issue in air travel with the early pregnancy. As the our main consideration, one is the labor, preterm labor, another is deep vein thrombosis. All are more towards the third trimester, not in the early trimester. However, the woman is if suppose they are at risk of miscarriage and they are at risk of ectopic pregnancy, such women where she has a previous ectopic pregnancy, history of recurrent miscarriage, okay, those patients should be prudent to confirm the locations and viability of pregnancy by ultrasound prior to travel, because these are the more prone, because she had a history of ectopic pregnancy, she had a history of miscarriage, so those patients are more risk factor. Again, in this pregnancy they get a pregnancy, ectopic pregnancy, they can got a miscarriage. So before you travel, you have to confirmation, you have a confirmation ultrasound to locate the pregnancy and whether it is viability or not. So that is very very important in these patients. Note that it is important to ensure the appropriate travel insurance. Then they should, if they are traveling from any other country or any malaria endemic country or any immunizations, any infective area, so they have to take in all the vaccination status has to be checked. Then however, in view of this difficulty as labor, it is prudent to avoid air travel from 37 weeks gestation in an uncomplicated singleton pregnancy. So I told singleton 37, if it is a multi is 32 weeks. Okay, one, that is for seat belt use, the woman should advise to ensure the strap is reasonably tightly fastened under her abdomen. So the strap has to be tightly fastened under her abdomen across the top of her thigh, okay, not over the umbilicus. Okay, with regard to minimize the risk, what are the advice you should during if they are allowed to travel. So first thing is have an ASL seat to facilitate easy movement. So there should be an easy movement during seat belt. The seat belt has some relaxations, easy movement has to be there. They has to take regular walks around the cabin and or carry out in seat exercise approximately every 30 minutes on a medium or long haul flight. If the flight has a long halt, so in that cases they have to do some seat exercise every 30 minutes, and the seat they have to some easy movement, they have to take a regular walk around the cabin. Maintain a good fluid intake, minimize caffeine intake and alcohol to intake to avoid dehydration, very very important. So maintain a good fluid intake, minimize caffeine intake, alcohol intake to maintain the hydrations. Make specific individual risk assessment for thrombosis. You have to give a before sending for air travel. You have to risk assessment who are flying for short hour journey. No specific measure likely to be required. For usually for medium to long, more than 4 hour, medium to this 2-hour journey is fine. If it is more than 4 hours, it suggests that all pregnant women are advised to wear a properly fitted, graduated. Remember, very very important, graduated elastic compression stocking has to be there. This is consistent with recent international guidance. Women may have an additional risk factor for thrombosis, such as if they had a previous history of deep vein thrombosis, symptomatic thrombophilia, such as antiphospholipid antibody syndrome, DVT, or a deep vein thrombosis, or heritable thrombophilia, morbid obesity, or medical problems as such as nephrotic syndrome. For such women, specific pharmacological prophylaxis with low molecular weight heparin in the dose recommended for antenatal prophylaxis should be considered for the day of travel and several days after. So, what are the indication of low molecular weight heparin? Remember, very very important question they can ask. The indication of low molecular weight heparin. First thing, if she had a history of DVT, okay, previous history of DVT, symptomatic thrombophilia like A+ syndrome or DVT, morbid obesity, they have to morbid obesity, any medical nephrotic syndrome. Such women, you should start low molecular weight heparin the day of travel till several days thereafter. Okay, very very important. It is and it should not be. It should be noted that aspirin alone is not recommended for venothrombosis prophylaxis, primarily because more effective method of prophylaxis are readily available. There is an association with potential non-obstructive hemorrhagic complications. Thus, that women at high risk of venothrombosis would be treated with low molecular weight heparin. Okay, what are the opinion? So remember, overall, I will tell there is no evidence that passenger air travel increase the risk of pregnancy complications such as preterm labor, rupture, abruption. There is no evidence of passenger increase. The radiation dose of the fetus also very very less, very negligible, unless the flight long haul air travel. Body scanner that utilize the ionized radiation for security check don't pose any risk to the mother or fetus from radiation exposure. Flight more than 4-hour duration has small increase in the risk, increase in the relative risk of venous thrombosis, but overall absolute is very very small. In the presence of specific risk factors for thrombosis, would be expected to increase the risk. Thereafter, specific risk assessment should be made for thrombosis in pregnant women who are traveling by air. The specific measure likely to be benefit are a graduated elastic compression stocking for women who are pregnant, flying medium to long haul flight lasting for more than 4 hours, and the low molecular weight heparin for those significant risk factor like those having previous history of DVT, morbid obesity, nephrotic syndrome, and A+ syndrome. All these patients you have to give low molecular heparin, and low dose aspirin should not be used in pregnancy for thromboprophylaxis associated with air travel. Very very important topic. Usually